we go. Okay, so I did mine on the rural poor population. So it's a vulnerable people. So first off, like the demographics of this, um, there's only 60 million people living in rural poor areas, which accounts for 19.3% of the population in the US. But the rural land consists of 97% of like the US's geographical landmass, I guess. So it's like very widespread compared to urban, which has tons of people in a small area. But the classification for rural is actually kind of funny because they have two classifications for urban. So urban, they have like urban cities, which is 50,000 people or more, or they have urban clusters, which is 2,500 to 50,000 people. And then they just classify rural as anything that is not urban. So they don't really have a set definition. Um, but there are also large differences between um, like sections of the country. So like the northern states, specifically like the Northeast, the people in the rural areas actually make a pretty good income. They do pretty well. They're I believe it was they make between 90 and 94,000 a year. So they do really well. Poverty is not really a problem there. But like in the Midwest and the southeastern states is where it is a big problem. So the income is like around 40,000, so a lot lower. So that's 40,000 for a household. And the poverty levels are about 20 to 24%. So there's a huge gap between places like sections of the United States. So the Southeast and Midwest are hardest hit by the rural, like living in rural areas. Um, as well, excuse me. Uh, so as well, like they're the ones who don't have access to medical care. But as well, just like the demographic of people living in rural areas that are poor, most of them are white males, and they're usually older, older than 18. So not many people of the 60 million people living there, I think it was only 13 million were below the age of 18. So most of the population in these rural areas are white and they're old people. Some of the vulnerabilities they experience like lack of access to medical facilities because it's common that like the nearest hospital will be hours away, or like a nearest doctor's office is going to be very far away. Um, and then the facilities that they do have, they aren't well staffed. They don't have a lot of resources. They can only handle like basic care. Anything big, like they would have to ship you off. But as well, like they have a hard time getting medical care providers, specifically doctors, out to rural areas because doctors don't want to go there. Um, so they also have a problem with having enough doctors to meet the needs of all the people, um, especially since most of the people are poor out there and they can't afford the medical care anyways. Some of the other things, because they are, most people in rural areas are old, they have common risk factors like cardiovascular, pulmonary, and cancer. So they have these just naturally because the population there is a lot older. So most people out there do have medical conditions. But also, I found this interesting. There also are very high rates of violence and abuse in rural areas. And one of the reasons for this is because like there's not people around. So they're remote. They don't have much social interaction. So it's easy for an abuser to take advantage of that. And also when abuse does happen, like the victim doesn't want to reach out because in small towns, they said it's like everybody knows everybody. They don't want to talk about it because they don't want to taint like their family name They don't want to look bad or ruin their reputation. And as well, they did say, I did read some articles that saying it is common that like people who are in authority will be related to abusers or things like that. So pretty much like the victims don't feel like they have anywhere to reach out to. And even if they did, there aren't any facilities close. They don't have things set up, like their infrastructure is very poor, so they don't have things set up to help victims of abuse or violence or anything like this. So these are some of the vulnerabilities they experience. Some of the actions that can be taken. So first off, like a lot of people don't visit the doctor. They don't, and a lot of people smoke out there. So the CDC recommended that like doctors in rural areas need to start screening patients and like promoting getting to the doctor and getting screened for high blood pressure. And the doctors and medical providers should make improvement goals to better improve their community's health. And as well, they need to set up things to get early detection because a lot of people have illnesses, ailments, and they won't go and get it checked out until it's emergent, until like it's life threatening. So the CDC recommends that the rural area doctors need to set up prevention and early detection programs so people can start getting treated for diseases before they're emergent. As most of this population, like I said, like the cardiovascular disease, a lot of it is related to their diet and exercise. So healthcare providers need to promote healthy eating, healthy living, just a good diet and exercise, well balanced, to help control obesity, control weight, so that they don't run into some of these problems. And as well, they need to promote smoking cessation. So again, because it's the most preventable cause of disease. And if they can get people in the rural areas to stop smoking, because it's more common in rural areas than in other areas, then they can also prevent some of these diseases that they are seeing. Another big one is a lot of people don't wear seatbelts. So they also need to promote, when they do meet with people, promote wearing a seatbelt, wearing a helmet, making sure your kids have booster seats. A lot of people in rural areas are just kind of like old time, like they don't think seatbelts or booster seats or things like that are needed. So providers need to promote that they do these things to protect themselves. Some of the organizations that are helping in this, Utah Health and Social Services. So this one kind of like helps connect people to like medical providers, helps them with insurance, things like that. Whereas AgriSafe actually is kind of an interesting one. It works specifically with farmers. So it reaches out to farmers in the area, and like promotes and helps them to be able to get connected with hospitals, healthcare providers, things like that. The American Hospital Association, that one like goes to like rural hospitals and connects them with other hospitals. So basically it's just like helping them get like a connection so that they can like better connect patients if they need more care. Rural affairs, again, is just kind of like an advocate for people in rural areas to make sure that they can get like funding to help get infrastructures in place so that they can get the things they need. And the National Association of Rural Health kind of does something similar, just kind of is an advocate for people in rural areas to be able to get like things like even like ambulances, different things like that, so that they can be able to get to and get the healthcare they need. And that is it.